Hi, my name is Hilal. I'm a student of Universidad Católica Santiago de Guayaquil, and today I'm going to share with you an interesting topic, which is ezetimibe added to statin therapy after acute coronary syndrome. First, definition. The use of 3-hydroxytrimethylglutaryl coenzyme A reductase inhibitors reduce both low-density lipoprotein cholesterol levels and the risk of cardiovascular events in patients with and those without cardiovascular disease. Intensive statin therapy, as compared with moderate dose statin therapy, incrementally lowers LDL cholesterol levels and rates of non-fatal cardiovascular events. Because of the residual risk of recurrent cardiovascular events and safety concerns associated with high-dose statin therapy, 10 additional lipid-modifying therapies have been sought.
Cardiovascular disease is the leading cause of illness and death in the United States. Statins help prevent cardiovascular disease in patients who have already had an event, but their use in patients who have never had but are at risk for cardiovascular disease remains controversial. Now, the United States Preventive Services Task Force, an independent volunteer panel of national experts in prevention and evidence-based medicine, recommends that adults without a history of cardiovascular disease use a low to moderate dose statin for primary prevention of cardiovascular disease events and mortality. If they're between 40 and 75 years old, have one or more cardiovascular disease risk factors, and if they have a calculated 10-year risk of a cardiovascular event of greater than or equal to 10%. The task force says that physicians can offer patients the option of using a low or moderate dose statin if they have the same risk factors but with a calculated 10-year risk of a cardiovascular event of 7.5 to 10%. Finally, they conclude that evidence is not yet sufficient to assess the benefits and harms of starting statins for primary prevention of cardiovascular disease events and mortality in adults age 76 years and older. The task force acknowledges that estimating 10-year cardiovascular risk isn't so straightforward. The pooled cohort equations from the 2013 ACC-AHA guidelines on assessment of cardiovascular
Applications in medicine. Ezetimibe targets the Niemann PC1-like-1 protein, thereby reducing absorption of cholesterol from the intestine. Polymorphism affecting NPC1L1 are associated with both lower levels of LDL cholesterol and a lower risk of cardiovascular events. Pros and cons. Pros. Ezetimibe targets the Niemann PC1-like-1 protein, thereby reducing absorption of cholesterol from the intestine. When added to statins, ezetimibe reduces LDL cholesterol levels by an additional 23 to 24% on average. It improved the addition to statin therapy of a no-statin agent, ezetimibe, which reduced the absorption of cholesterol from the gastrointestinal tract, lowered LDL cholesterol by approximately 24%. Cons. The primary efficacy endpoint was a composite of death from cardiovascular disease, a major coronary event like non-fatal myocardial infarction, documented unstable angina requiring hospital admission, or coronary revascularization occurring at least 30 days after randomization, or non-fatal stroke assessed from the time of randomization until the first occurrence of one of the events. Issue applied in Ecuador. According to data from the 2016 census of the National Institute of Statistics and census, acute coronary syndrome was the leading cause of death of the Ecuadorian population. Conclusion. The addition of ezetimibe to statin therapy is stable patients who had an acute coronary syndrome and who had LDL cholesterol levels within guideline recommendations for lower the risk of cardiovascular events. The event reduction was consistent with the predicted effect seen with statins, even in the range of low LDL cholesterol levels in this trial. And no offsetting adverse events or toxic effects were observed. Now, a video.
20 million Americans take statins, a class of drugs that protects against cholesterol buildup in the bloodstream. Now the FDA is requiring statin manufacturers to warn consumers about the drug's potential risk for cognitive problems and for elevated blood sugars that can lead to diabetes. Dr. David Dicek, a UW Medicine cardiologist, discusses the issue.
Statins are commonly prescribed because they treat elevated LDL cholesterol, the bad cholesterol, which causes heart attacks. And in many studies, statin prescriptions has been shown to decrease cardiovascular mortality. It does currently seem as though these side effects affect only a small number of patients. Nevertheless, it's the FDA's job to put out these reports at an early stage so that people who are concerned about side effects can address them with their physicians. Well, first I would review what I saw as the risk-benefit relationship with the statin drug. Some patients are at particularly high risk for cardiovascular disease and derive a very high benefit from statin therapy, others less so, and also individual patients will vary in their tolerance for the side effects, a high glucose or a mild memory impairment. We might try to reduce the dose or even stop it if this was really unacceptable to the patient. But the patient would have to know that they were accepting an increased risk of heart disease by stopping the statin. I think the best approach is to contact one's physician and engage in a discussion of the risks and benefits of statin therapy. That will be an individualized decision, but it is optimally made with the guidance of a physician who knows your medical history well.
Thank you.